Hello everyone. Welcome back to our channel, Learn with Professor Janula. Today, we are going to talk about the signs of pregnancy. Recognition of pregnancy is essential for providing early antenatal care. The signs and symptoms of pregnancy are classified into three groups: presumptive, probable, and positive signs, depending on their diagnostic value. Presumptive signs are those felt by the woman herself. Probable signs are those observed by the nurse or doctor during examination. Positive signs are those confirmed by technology or direct evidence of the fetus. This classification helps us understand how pregnancy is first suspected, then examined, and finally confirmed. Now let us talk about the presumptive signs of pregnancy. These are subjective symptoms that are felt by the woman herself. They are not fully reliable, because they can also be caused by other conditions. The first one is amenorrhea, which means the absence of menstruation. This is often the earliest sign noticed, but it may also happen due to stress, illness, or hormonal changes. The second is nausea and vomiting, often called morning sickness. This usually appears in the early weeks of pregnancy. It happens because of hormonal changes, but remember, nausea can also be caused by stomach problems or infections. The third is breast changes. The woman may feel tenderness or enlargement in her breasts. The areola, which is the dark area around the nipple, may become darker in color. These changes are due to hormonal influence. But similar changes can also occur with hormonal treatments or menstrual cycles. The next presumptive sign is fatigue. Many women feel unusual tiredness in early pregnancy. This happens because the body is using extra energy to support the growing baby. However, fatigue can also occur due to lack of sleep, stress, or illness. Another sign is urinary frequency. The woman may feel the need to urinate more often. This is because hormonal changes increase blood flow to the kidneys, and the growing uterus puts pressure on the bladder. But remember, urinary frequency can also happen in urinary tract infections. The next one is quickening. This means the first fetal movements felt by the mother. It usually happens around 16 to 20 weeks of pregnancy. The woman may describe it as a fluttering or light tapping inside the abdomen. However, similar sensations can sometimes be caused by gas movement in the intestines. Finally, there are skin changes. These include chloasma, also known as the mask of pregnancy, which is dark patches that appear on the face. Another is linea nigra, a dark line running down the middle of the abdomen. Striae gravidarum, commonly called stretch marks, are also common. They appear on the abdomen, breasts, thighs, or hips as the skin stretches to accommodate the growing baby. At first, they look reddish or purple, but later, they fade into thin silvery lines. These changes are due to hormonal effects and stretching of the skin. But remember, some pigmentation changes and stretch marks can also occur in other conditions. Now let us talk about the probable signs of pregnancy. These are objective findings observed by the examiner. They provide stronger evidence than presumptive signs, but they are still not conclusive because similar changes may happen in other conditions. The first one is enlargement of the abdomen. During pregnancy, the uterus grows to support the developing baby, leading to a progressive increase in the size of the abdomen. However, enlargement can also be due to tumors, obesity, or other medical conditions. The second is Heger's sign. This means softening of the uterine isthmus, which is the area between the cervix and the body of the uterus. It can usually be felt around 6 to 8 weeks of pregnancy. But softening may also occur in some gynecological problems. The third is Goodell's sign. This refers to the softening of the cervix. It usually happens around 6 weeks of pregnancy due to increased blood flow and hormonal changes. But again, softening of the cervix can also occur in other conditions. The next probable sign is Chadwick's sign. This is a bluish discoloration of the cervix, vagina, and vulva. It usually appears around 6 to 8 weeks of pregnancy due to increased blood flow. But this color change can also be seen in other conditions that cause pelvic congestion. Another sign is ballottement. This is when the examiner taps on the cervix and feels the fetus rebound within the amniotic fluid. It can usually be detected between 16 to 20 weeks of pregnancy. However, similar findings may sometimes be caused by other pelvic masses. The next is Braxton Hicks contractions. These are irregular and painless uterine contractions that can be felt during pregnancy. They are sometimes called false labor pains, but uterine contractions may also occur due to other reasons. Finally, a positive pregnancy test is considered a probable sign. These tests detect the presence of the hormone HCG in urine or blood. While they are helpful, they are not fully conclusive because false positives can occur in some medical conditions or after certain treatments. Now let us talk about the positive signs of pregnancy. These are conclusive signs because they are directly attributable to the fetus. They cannot be explained by any other condition. The first positive sign is fetal heart sounds. These can be heard with a Doppler device as early as 10 to 12 weeks of pregnancy, and with a fetoscope around 18 to 20 weeks. The second is fetal movements palpated by the examiner. After about 20 weeks, the healthcare provider can feel the baby's movements by placing a hand on the mother's abdomen. The third is visualization of the fetus. Using ultrasound, the fetus can be seen as early as 4 to 6 weeks of pregnancy. This is one of the most reliable ways to confirm pregnancy. To summarize the topic, signs of pregnancy are divided into 3 categories: presumptive, probable, and positive. Presumptive signs are felt by the woman herself. These include missed periods, nausea and vomiting, breast changes, fatigue, frequent urination, quickening, and skin changes like chloasma, linea nigra, and stretch marks. Probable signs are observed by the nurse or doctor. They include enlargement of the abdomen, Heger's sign, Goodell's sign, Chadwick's sign, ballottement, Braxton Hicks contractions, and a positive pregnancy test. Positive signs are conclusive and directly confirm pregnancy. These include hearing fetal heart sounds, feeling fetal movements by the examiner, and seeing the fetus on ultrasound. Or remember the presumptive signs of pregnancy. We can use the mnemonic fan club. F stands for fatigue, which means unusual tiredness. A stands for amenorrhea, or missed periods. N stands for nausea and vomiting, commonly known as morning sickness. C stands for changes in breasts and skin, such as darkening of the areola, chloasma on the face, and linea nigra on the abdomen. L stands for leaking urine or urinary frequency, which is the increased urge to pass urine. U stands for uterine quickening, the first feeling of fetal movements by the mother. B stands for breast tenderness, where the breasts may feel sore or sensitive. This simple mnemonic fan club makes it easier to recall the presumptive signs of pregnancy. To remember the probable signs of pregnancy, we can use the mnemonic Big Chaps. B stands for Braxton Hicks contractions, which are irregular and painless contractions of the uterus. I stands for increased abdomen size due to the growing uterus. G stands for Goodell's sign, which is the softening of the cervix. C stands for Chadwick's sign, the bluish discoloration of the cervix, vagina, and vulva. H stands for a positive HCG test, which detects pregnancy hormones in blood or urine. A again stands for abdominal enlargement. P stands for positive pregnancy test, repeated here for emphasis. S stands for softening of the uterine isthmus, also known as Hegar's sign. This mnemonic, Big Chaps, makes it easier to remember the probable signs of pregnancy. That's all about signs of pregnancy. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.